Welcome back. In this video we'll talk about celiac disease. We'll explain the pathophysiology, the symptoms, and the treatment. The main cause of celiac disease is hypersensitivity or allergy to gluten. So if these patients consume gluten-rich food, once the gluten touches the intestinal lumen, it will trigger allergy. And as we know, allergy means activation of inflammation process. And so, T-cell lymphocytes will chemotactically aggregate and accumulate in the intestinal wall. Inflammation is a destructive process, and so this will destroy the villi. And without villi, there will be no absorption. The area of the intestine that is most commonly affected is the distal duodenum or proximal duodenum. So it's basically the junction between these two parts. So in short, if these patients eat gluten-rich food locally in the intestine, they will have destroyed villi and malabsorption. And of course, this leads to all sorts of problems from osteoporosis to anemia. But there are some other systemic symptoms, like dermatitis herpetiformis. These are small papules or lesions that occur in the elbows of these patients after they eat gluten. These lesions are very itchy and they often will be infected. If they are infected, they should be treated by Dapsone. If we go back to the intestine and we take a small sample of an area that is affected, aka an area with destroyed villi, we'll see high levels of immunoglobulin A anti-tissue transglutaminase, anti-endomysial, and anti-deamidated gliadin peptide antibodies. So these are the antibodies responsible for gluten allergy. If the infection is persistent for a long time, for example, if the patient continues to eat more and more gluten, it will demand more and more T-cell lymphocytes. And as the body produces more and more T-cell lymphocytes, it increases the chance of developing defective T-cell lymphocytes. And so, it increases the risk of malignancies of T-cell lymphoma. Diarrhea test is an old test that we don't use anymore, but you'll see it more in the exams. In a healthy patient, we'll give them the diarrhea containing fluid and they will drink it, and then this fluid will go into the intestine and then absorbed into the blood, and then we'll take a blood sample and we'll see the diarrhea in the blood sample, and this indicates an active and functioning absorption. In patients with celiac disease, they will have destroyed villi and thus destroyed or defective absorption. And so once these patients drink the fluid containing the diarrhea and we take a blood sample, we'll see very little or no diarrhea. And this basically indicates malabsorption. This test is not really sensitive because it doesn't tell you the cause of malabsorption. It just points the finger at some cause of malabsorption. But it doesn't do a good job at even that, because some other causes like bacterial overgrowth can destroy the diarrhea. And so even if the patient had good absorption, but they had bacterial overgrowth, we'll see low diarrhea in the blood. The treatment is simply gluten-free diet. And here's a small quiz. Which of the following products does not contain gluten? And the answer is rice. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.